Quick question. What is osteoarthritis? Is it a degenerative wear and tears problem, or is it an inflammatory joint disease? Now here is the twist. If you picked inflammatory joint disease, you are wrong. But if you picked degenerative joint problems, you are also wrong. And this confusion is exactly why millions of people with osteoarthritis are still being mismanaged and misadvised. For years, osteoarthritis was taught as a simple wears and tears. You get older, your cartilage wears out, your bone rubs on each other, end of the story. But modern science has completely destroyed that idea. Osteoarthritis is not just a cartilage problem, it affects the entire joint. The cartilage breaks down, the bone remodels and forms osteophytes, the ligaments and menisci weakens, and most importantly, the synovium becomes inflamed. Yes, that's correct. Osteoarthritis causes true synovitis. That means swelling. There is fluid, warmth, morning stiffness, and flare-ups from time to time. This is why osteoarthritis does not behave like a dead joint. It behaves like an irritated, inflamed one. When the cartilage breaks down, it releases inflammatory chemicals into the joint. Those chemicals irritate the synovium and attract immune cells, and also sensitize the pain nerves. So, osteoarthritis creates its own inflammation, even though it's not an autoimmune disease like rheumatoid arthritis. Another common question is why osteoarthritis flares? And this is something which every patient knows. Some days are okay, some days it swells up, some days it locks, some days it hurts at rest or wakes people up at night. This is a typical inflammatory behavior. If osteoarthritis was purely mechanical, that is, wears and tears, steroid injections wouldn't work, but they do, especially in the arthritis of the thumb, the knee, wrist, and elbow. If you have an ultrasound check, you will clearly see an active, or in some cases not too active, synovitis in the joint. And when you calm that inflammation down, pain does improve. So what exactly is osteoarthritis really? In a nutshell, osteoarthritis is a mechanically driven inflammatory joint disease. It's degenerative in origin, but inflammatory in behavior. And this is why modern osteoarthritis management is not just live with the pain. It's more of a combination of many approaches: load management, exercises, weight control, managing the acute flare-ups, and steroid injections when needed. In summary, osteoarthritis is not non-inflammatory, and it's not just wears and tears. It's a disease of degeneration plus inflammation. And now, you'll never see osteoarthritis the same way again. Thank you for sticking around. If you find this helpful, like, share, and also send to your colleagues. Bye for now.